Hello everyone, my name is Mary Nguyen and I'm a clinical research coordinator here at UCI MIND. So right now I am currently transitioning from a recruitment role to more of a study coordinator role. And before, when I was main recruitment coordinator, I would be the primary point of contact for those who were interested in learning more about clinical research and the studies that we are offering here at UCI MIND. For now that I am transitioning to this new role, for study coordinator, I am kind of doing more of a hands-on experience, since I will be seeing patients in clinic and assessing their needs and making sure that they are following protocol when it comes to our studies. In addition to that, I also collect biospecimens and record data for each of our individual participants in our studies. And right now I am also training to administer cognitive testing. So hopefully that will allow me to grow my skill set in order to complete even bigger cognitive batteries for our participants. I've been with UCI MIND for about 2.5 years now, I believe, and I initially was interested in the growing field of neuropsychology, as well as the growing use of neuropsychologists, especially in this particular field. One of my goals is to eventually get my PhD in clinical neuropsych and kind of focus on the cognitive assessments and testing that is involved in making sure, or in diagnosing certain participants. So over the years, as I continue learning about the prevalence of dementia, I am unfortunately also learning about the lack of access for underrepresented groups, as well as the barriers to recruiting underrepresented groups and minorities to be involved in our clinical studies and trials. And I think that's been really the driving force in me wanting to receive a PhD in clinical psychology, really to assess whether these cognitive assessments are effective and inclusive when it comes to diagnostic and clinical relevance. And I think that's something that resonates pretty deeply with me, growing up with immigrant parents and English not being their first language, translating, and throughout the years, my growing concern of them not receiving the best care because of maybe lack of specialists in the area, and really that cultural and language barrier. I think that's a growing fear of mine as they continue to grow older, and I think that's what motivates me to want to pursue the degree, but also just to provide any information I can to my community. I think any resources I'm able to equip myself with and continue to divulge to people in my community, that's something that keeps me motivated to do what I do.